Thank you, Jacqueline. I'm called Dr. Martin Otyek Opio. I'm a physician at Medipal International Hospital. Yes. So I think to begin with, first let's talk about what are clots and why the clots happen. Are they good or are they bad? So the way the body is, our body has been designed is that, for example, when you get a wound, when you fall down and you begin bleeding, the body is supposed to stop the bleeding after a while by declotting the blood in the site of the bleeding. So there are components in blood which have also been designed which are designed to clot blood where there's any bleeding or any damage to any blood vessel, and they're actually helpful most times. Yes, but they can also be harmful at times. That same process too. Yeah. So there are cases where clotting is good, and also scenarios where clotting is something bad too. Yeah, and there are also two kinds of clots you can have, either in what we call the veins. Veins are blood vessels which carry blood back to the heart. Then there are also clots which can happen in arteries. Arteries are blood vessels which carry blood from the heart to the rest of the body. So they happen in two different ways, different mechanisms, and even management is equally different too. So I'll begin with the way clots which occur normally, which occur usually in veins. So the way our body is designed is that when you are, let's say, normally we are always moving. We are either walking, either we are basically doing different activities. So like, for example, if you look at the veins, usually in the feet, in the legs, they are designed to push blood up to the heart by the muscles around them contracting. So if, for example, you're in bed for a long time, you're sick for one reason or the other, you're not able to walk, either you've got a stroke. So usually the blood flow in the legs is usually fairly slow. So once that happens, chances of blood clotting in the veins is fairly high. It can happen in the veins in the legs or in the veins in the lungs too. But most times the causes being basically at rest for long, either in bed for long, that movement, or at times people who have got genes or have got genetic risk factors for getting clots easier and more easily than others. That's possible too. Now the other kind of clot which occurs in arteries is a bit different. The mechanism normally is mainly one, either having high cholesterol in blood for a long time, and usually happens very slowly. It takes time to happen. So you find fat accumulating within the artery. It keeps narrowing the artery over time. So after many years, one day either the clot where the clot is in the artery may either break off, or other cells in the body may actually clot around there and block the blood flow from there. Yeah, that can also cause either a stroke. So the clots caused by which occur in veins tend to cause what you call venous thromboembolism, meaning they occur either usually in the legs, or if you're unlucky, in the lungs. If they occur in the lungs, risk of death is fairly high. The one which occurs in arteries lead to what we call either a stroke or heart attack most times. Yeah. So if you look at, let's say, clots which occur usually in veins, the main cause normally is one is basically if you are not moving, if you're in bed for some time, either because you are sick, normally because you are sick, or either because you are disabled. If you're in bed for a long time, you're not moving your legs, you're not moving your hands, you may get clots in the legs. Now, if you're unlucky that the clots keep on becoming bigger and extending, they may actually break from the legs there and move to the lungs. Now, depending on how big they are, they may cause either mild symptoms or severe symptoms. So if it is a small clot which ends up in the lungs, you'll have mainly mild symptoms. Some difficulty in breathing, you will survive. If it's a big clot which lands on a big artery, a big vein actually in the lungs, you may actually die. Yes. So that's usually the main cause. For a few other people, it's mainly genetic risk factors in a few of them. But there are also drugs which may also cause the risk of clotting to be high, like contraceptives. They can also cause it too. It's one of the side effects too of contraceptives, or female hormonal therapy can also cause that too. Sometimes too, things like either having a cancer can also cause it too. Having also obesity can also cause it also. Also things which may cause a clot in the veins, either in the legs or in the lungs. So now with accidents, what actually happens is what actually is saying is a kind of clot which happens not in the arteries or in the veins, but other parts of the body. For example, if you have an accident and basically your head you knock your head on a door or either on something, and then the arteries or veins in the brain damaged and you bleed. When that happens, you may get bleeding in the brain, around the brain. But usually the bleeding, what happens is not in the arteries. It happens in the tissue. So it happens eventually you get clots happening not in the vein or artery, but in the tissue around there. So that kind of bleeding and that kind of clot normally is managed differently. Now if it is in the brain, it is more serious because one, the way our body is, the brain is in a small space, which is covered by a bone, that is the skull. So any increase in any swelling in the brain is not wanted there because the space for the brain is just small. If you add there a clot, it increases pressure in the brain and not lead to damage to tissues in the brain. So normally that kind of clot normally happens in accidents, any kind of trauma, and normally it may require drilling of a hole in the brain and draining of the blood. If it happens in the legs or in the abdomen or in the hands or feet, it's not so serious. They normally even leave it on its own. The body will basically absorb the blood slowly with time. But if it happens in the brain, then you're more concerned about that. So that's a different kind of clot that we're talking about. DVT basically means deep vein thrombosis. So if you look at our bodies, if you look at your hand or even your feet, your legs, we have veins. If you look at my hand, you can see some veins on my hands. Now these veins you see in my hands are not deep veins, they are superficial veins. Then there are also deep veins which are inside the arms too and the legs too. Now the deep veins are inside the muscles. Now for blood to leave the legs to go back to the heart, there's no pump in the legs. So what happens is that the muscles in the legs, the muscles in your calf will, as you walk, the muscles will contract and squeeze the veins which are in the calf to push blood back to the to the heart. Now veins have what you call valves, they're like gates. The gates only allow one-way flow of blood, that is towards the heart. So when these veins are squeezed by the muscles, blood which is in them flows towards the heart. Now, what happens is that if you are not, either you've got a stroke or you are unable to move, either because of a severe disease or any other reason, you're in bed for more than 3 days, so that blood which is in the legs, in the feet, flows back very slowly. And that slowing down of blood flow can lead to a clot happening in that deep vein. So it can happen in the legs, can happen even in the arms, which is rare, or even in the brain. There's something called a sinus in the brain called a sagittal sinus, which is made up of a big vein in the middle of the brain. Can happen there also. Actually, the clots which are happening in COVID happening mainly where? In that vein in the brain. So that's what's called a deep vein thrombosis. It normally tends to come more in the legs first, but can also end up in the lungs too. Venous clots, venous thromboembolism. Okay, so for venous, basically anybody who is very ill in hospital and cannot move are at very high risk. That is one. Okay, pregnancy, contraceptive use, having cancers, also can also lead to a clot in the veins too. Yes. Also risk factors. But for the clots that occur in arteries, it's mainly lifestyle. If you are obese, if you have hypertension, if you have diabetes, the risk is actually high getting a clot in the heart or in the brain. Or if you are unfortunate, you can get a clot in the arteries which are in the legs, and it end up being cut off eventually. So the answer for arteries is mainly lifestyle basically. More if you have high cholesterol in the body, if you don't move much, you work from. Let's say you go to work in the morning, you don't do exercises, you basically sit the whole day. You're actually at risk of getting a clot in the heart or in the brain with time. Yes. So for the venous clots, why the legs? I think partly because the legs are farther away from the heart. So the blood leaving the legs coming to the heart actually takes more time. There's slower flow in the legs as compared to either the abdomen or the arms. That's actually the main reason. But also again, if you look at the legs again, they have longer veins there too. That might be the reason why they're actually more common in the legs. Yeah. Although they can also happen in the hand, in the arms, but that is a bit rare. But it's also possible too. Yes.
Thank you, Dr. Martin.
Yes.
Now, how can somebody get to know that maybe I'm having a blood clot? In several times,
So basically, yeah, as I mentioned, it's mainly symptoms. So for clots which happen in the legs, now most times you'll have swelling of the leg. One leg will swell more than the other leg. Yes. So if you have one leg which is swollen more than the opposite leg, that could be a clot. So it tends to swell and be a bit warmer than the opposite leg. And when you press on it a bit, it tends to pit a bit. Yeah, but normally the main thing is swelling of one leg more than the opposite leg. It's normally a symptom of different thrombosis in the legs. For in the lungs, normally you may get difficulty in breathing. You're okay, then suddenly you get difficulty in breathing out of nowhere. You have no cough, you have no chest infection, you have no asthma, but sudden difficulty breathing from nowhere. Although most times with what happens in the chest, it depends on how severe it is, how big it is. If it's a small clot, basically you get difficulty in breathing. If it's a big clot, it may be worse than that. Maybe collapse, maybe faint, and get even into coma. It's possible. Yeah, but for the legs, usually you get swelling of one leg. Maybe the thigh, maybe the leg, maybe the feet. Yes. So when you have clots in the veins, basically it's mainly medication. Now, what drugs do? There are two kinds of drugs for clots which happen in the legs or in the lungs. So it depends on how severe it is. If it is very severe and it is in the lungs, the drugs which you can give, which can break the clots immediately. That's one option. The other option is that if you have a clot in the lungs or in the legs, which are not very serious, meaning you're not in coma, breathing is not difficult, you may give drugs which prevent the clot from extending, from becoming bigger. Once you prevent that, the body eventually with time breaks it down on its own. Yeah, so the first drug breaks down the clot on its own. The second drug prevents the clot from becoming bigger, going further. Then the body will eventually break it down on its own. The body has components in it which break down clots over time. Yes.
these clots move?
They can. If you have a clot in your thighs or in your calf, and the clot breaks from there, it may end up in the lungs. Yeah, and once it ends up in the lungs and lands on an artery in the lungs, or in a vein in the lungs, then you're in trouble. So they can actually break off and move at times. So the main aim is to prevent them from moving forward to another part of the body, causing more damage. That's the main reason why we give the medication early. So what happens eventually, if you have a clot which blocks a vein, so in the very beginning you have the vein is all blocked. So over time, these components of blood begin breaking down the clot slowly, more or less like eating it up. So we try to find that the clot is broken down and absorbed by the body, and eventually you have just either a small bump there where the clot was, or even at times there'll be no evidence of any clot there. So it's basically the body dissolves the clot on its own. It doesn't break it to particles, but into basically, maybe say, let's say in simple terms, liquid form, more or less. So checking clots, the most effective way is by doing an ultrasound of the. Now, this is for venous, for clots in the veins. You do an ultrasound scan of the leg, or of the leg or of the thigh. Now, if it is in the lungs, though, we do a CT scan of the lungs. So also for the legs, basically we do ultrasound scan of the veins on the legs. So what do you look for in the scans? You look for either whereby there's something thick, which is blocking the vein. So what they do is something called either compression ultrasound or Doppler ultrasound scan of the legs or of the thighs. Whereas for the chest, for the lungs, we do a CT scan. We give a drug which is called contrast, which lights up the arteries and the veins in the lungs. Then you take a photo on a CT scan, so you're able to see where there's blockage of flow of blood. That's where the clot is. Now, some people get mild or small clots in the legs, which we term eventually the body tends to eventually dissolve it. The way the body is designed is that where there's a clot in a vein due to venous thromboembolism, the body tends to break it down. Yes. So if it's a small clot, the body may actually break it down on its own. If it's a small clot, even with no medication. Even the drugs we give for clots in the legs don't break it down. let's prevent it from becoming bigger so the body can actually break it down on its own. Yes, very easily, because if it's a mild clot, by the way, you can very easily miss it. If it's a small clot, you can very easily miss it. Even if it is big and the symptoms are mild, you can even underestimate it. In fact, most people get clots and die, by the way, never know that they have clots in the legs. Yeah, most never know. Until they collapse or faint somewhere, then it's discovered in the legs and in the lungs. Most never know. So if you have no symptoms, it's hard to know. Because if you feel fine, the legs are not swollen, you're breathing well, it's hard to tell that you have a clot. And unfortunately too, most of our investigations which are done, like let's say routine checkups, don't look for clots. Yeah, we focus on other things. Focus on, let's say, seeing how the blood is, seeing how the pressure is, the kidney is, but not for clots. Yes.
What are some of the myths about blood clots?
Myths. Myths about blood clots. I can't say I know very many of them. But of course, we know that when people get swelling of the feet, they think of so many things. They think either they've been bewitched, for one reason or the other. They may think it's just, now actually at times, you may think it's an infection, at times. Because if you get an infection of the leg, it will also swell, almost in the same way, although a bit differently. So it may easily miss it. But most times people think it's witchcraft. Yeah, but you have worked on some herbs somewhere, somebody's garden, somebody's house. Yeah, so it happens. People think so, and at times they ignore them. Yes. Yes. So if you don't die, which is the worst effect, if it's a big clot in the leg may remain swollen for some time and painful at times. Yeah, even when the clot is gone. It may damage the valves, the gates in the legs. So you may get a bit of swelling of that leg on and off with time, which could be uncomfortable. Yeah, that may remain for some time. But most times when the clots have been managed and have resolved on their own, you tend to be fairly okay. Yes. If you survive, just if you survive. Now, yes, it's true. Because for venous, once they're managed, basically the artery is okay, whether it's in the lungs or whether it's the vein is okay, whether it's in the lungs or in the legs. But now for arterial clots, it's a bit different. The ones in the arteries, because when they happen, when you get a clot in the heart or in the brain, chances are high that area where the clot happened remains narrower, may remain narrower with time. And if it remains narrow with time, you may get another clot again in future, very possibly, even worse than that in the same spot. So that's why normally with the clots which are in the heart, we can attempt to put metals inside there to open that part of the artery, so it remains open for long. We can put some kind of metal, what we call a stent, to open that particular artery. So for arterial clots, the risk of future clots is high, is very high, and so that we managed. So what normally do? We give drugs to prevent blood from clotting in that same area, or even in other areas of the heart or the brain. And once you begin on those drugs, they're taken for life. You don't stop. Whereas for venous clots, we give drugs for about 3 to 6 months, then we stop. Once you find a clot in the heart or in the brain, you take drugs to prevent clots from happening for life. Yeah.
All right, thank you very much. What's infections?
Faint. So for arterial clots, really, it's basically our lifestyle. One, make sure that you're active. Yeah, sports, exercises every week, maybe 2 hours every week, 2.5 hours every week. It's good. Make sure that if a patient is sick in hospital and they're not able to leave their beds or the chair, they may require either physiotherapy, someone to move the legs and the hands for them regularly, so the blood is flowing normally throughout the body. Okay? Or 2, if they're in ICU in hospital, normally we give drugs to prevent clots from happening while they're in hospital until they're able to go home and begin working on their own. Whereas for That's for venous. For arterial is basically lifestyle. No hypertension. Make sure you have no hypertension. Make sure if it's there, you manage it properly. For diabetes, if you have diabetes, you manage it properly, adequately. If you have high cholesterol, manage it adequately too with drugs. And normally hypertension, diabetes, and high cholesterol, drugs are taken for a long time. Hypertension and diabetes almost for life. Because if you stop drugs at some point, you may get clots happening at some point too. So for arterial, it's basically lifestyle, exercises, eating well, food with low cholesterol, food with low carbohydrate contents, exercising, managing hypertension well, diabetes well, high cholesterol well also. Yeah, that is the main thing for the arterial clots in the arteries. Whereas for clots in the veins, it's mainly of course being active, avoiding being in bed for so long, and where a patient cannot leave the bed, giving drugs to prevent clots from happening. Yes. Yes.
What happens to the blood cells after blood clotting?
The blood cells.
The red blood cells.
So normally, what happens with the red blood cells usually when you get a clot is that so when you get a clot, either in the veins or in the arteries, so you get there's some particles in the blood which cause clots. So when they cause clots, they cause, let's say, a mesh where the clot is formed. So the red cells end up on the mesh there and get stuck there, making part of the clot. Yes, so that happens. And for that to open up, either require the body breaking it down on its own, or in the case of very severe clots in the lungs, you give drugs to actually break down that clot, which happens. Because if you look at the clot, it has blood cells in it and further components too in them too. Yeah. There's no clear food which you say don't take, but maybe there's normally a drug given for clots called warfarin. It's an affordable drug. It's a tablet given for clots in the veins. Yeah, so normally it's a good drug. It does work well. It's affordable. But if you eat vegetables in high quantities, it may limit its effect. So normally if you're taking a drug called warfarin, we normally ask you to avoid taking green vegetables or take just a little of it over time. Because if you take large quantities of green vegetables, it prevents the drug from working well. Yeah, but for other drugs, which are for the newer drugs, it doesn't really matter what you eat. That is for clots in the veins. For clots in the artery, of course, we want you to eat a diet which has low cholesterol in it, a low fatty diet, yes. Because the fats are linked to causing this narrowing of the arteries and majorly the clots. So if you have already a heart attack or a stroke, we limit the intake of what? Of animal fats. That's cholesterol, basically. Yes. The best treatment for blood clots depends on how sick a patient is. For example, if a patient is very sick, the clot is in the lungs, they have collapsed, the heart is failing because of the clot, we have to break it down. The drugs which we call thrombolytics, there are many in the market, thrombolytics, like streptokinase, tenecteplase, they're available. They actually break down the clot within a few minutes. They can break it down. So if a patient is very sick, the clot is in the lungs, they've collapsed, and the heart is struggling to work. You have to give them the drug to break the clot. But if the clot is not big, and the breathing is not that bad, the heart is functioning normally we don't use them. Why? Because these drugs, as much as they're good, they can also cause bleeding in the brain. Yeah, as a side effect. So we want to give it to clients who need it, where the benefit outweighs the risk of bleeding. So if it's a mild clot, a small clot in the lungs, we may give drugs like, let's say, it's what you call heparin. Heparin basically prevents clotting of blood. So there are different kinds of heparin. There's what you call low molecular weight heparin, like enoxaparin. It's a good kind of drug for that heparin. And the drugs like warfarin, drugs like rivaroxaban, so those are tablets which you take. They won't prevent clots from becoming bigger or from progressing. Yes. So basically, so heparin, the warfarin and the rivaroxaban work almost. They do almost the same thing, preventing clots from becoming bigger. Whereas the thrombolytics actually break the clots. Yeah. But also. Oh yeah. Okay. Now, what is actually saying about operation? We're talking about clots which happen in the what? In the heart or in the brain, in the arteries. Now, what they usually do is something called thrombectomy. where they can put it's a procedure where they put a wire through one of the vessels in the thigh, or in the what, or in the wrist. So they put a wire which goes up to where the clot is. But you have to be able to see the clot on a machine, which shows you how blood is flowing and where the arteries are. So you go up to where the clot is and you break it with that equipment. Either you break it or you open up the vessel. Yeah, it's called thrombectomy. Now, if it is in the heart, other than just breaking, we can also put there a piece of metal, which opens up and also keeps the vessel open, preventing further clots. They're called stents. Yeah, they can be done in what we call a cath lab, which we have in Medipal here also. Yes, and Nakasero has one also. So does also Mulago. There's several in town. Yeah, because normally it's an emergency if it's in the heart, and usually the aim is to do it within the first 6 to 9 minutes, or if possible at most 90 minutes. Yeah. So it's a very important intervention and very effective. So medical basically is a specialized hospital. Yes, we do have a number of facilities and doctors too. We do have, of course, we admit patients. We have in and outpatients too. So for the outpatient department, we have an entire floor for outpatient and emergency also. Then we also do have inpatient wards, 2 inpatient wards. Yes, so in Medipal, we have got a department which contains what you call a cath lab. Yes, now a cath lab basically let's say this is a room where the equipment which are able to be used to access arteries or veins without opening the skin, cutting somebody open. For example, if you get a clot in the heart, a heart attack, so we can actually what you call operate, in quotes operate. So they do have a wire which they put into the artery, which goes up to the heart to where the particular clot is, and can break it down. Or either you break it down, or you can put even another piece of metal there to open up that particular artery to allow blood flow and limit damage to the heart. So we got the equipment in Medipal. I think since we had them installed a few weeks ago, they're now fully installed and ready to be used. Yes, but that's mainly for the arterial clots. Even for clots in the brain, yeah, in the arteries in the brain, they can also use the same equipment too. The same kind of process, what we call endovascular thrombectomy, to actually open up those clots in the brain too, the ones in the artery. Of course, for venous clots, we do not use that for venous clots. We only use drugs for that. No cath lab is necessary for that. Yes, we can. Whether it is in the veins, whether it is in the heart. Yeah, we used to have an ICU, because if you get a clot in the heart or a severe clot in the lungs, you must manage in an ICU, an intensive care unit, which we do have also in the hospital, and with a fairly good team of intensivists too. Yeah. So my last remarks: venous and arterial clots are very common, and actually for the clots in the heart and clots in the brain, the heart attacks and the strokes, they're going to increase with time. That's for sure. And actually, that's going to be our next epidemic as a country: hypertension, diabetes, clots in the heart, clots in the brain. So the main thing is to try and prevent it. One is lifestyle modification. Let's be more active in our lifestyle. Let's do regular checkups. Let's check our pressure. Let's check our blood sugars. And if you have any of them, hypertension or diabetes, let's manage them adequately, aggressively, and early. Yes, once you do that, you can actually limit the risk of getting a clot in the heart or in the lungs. For clots in the legs, just be vigilant. If you have swelling of one leg and it's painful, the leg is not painful, go to hospital. If need be, do a scan of the leg. You rather be paranoid than miss something that may cause death. Yes, yeah.